Hello, my name is Tom Mrozla from the University of South Dakota, and I'll be talking a little bit today about rural policing in a pandemic. I have my pal Rosie here too, and maybe she'll help me out. Um, this research is important a couple of different ways. The first way is it's important to pay attention to rural police agencies. Much of our research in policing and criminology in the field comes from large urban departments or large cities. This is interesting because many of the police departments in the United States, over half, employ 10 officers or less and are in these rural areas. So it's important to pay attention to them as well. It's also important from a contingency theory perspective. If you study organizations in the past, you know that they structure themselves to become more efficient in response to whatever is going on in their task environment. And these are known as contingencies. And these contingencies could be anything from funding to people to turbulent events. And right now we're experiencing a turbulent event of a pandemic. We know the effects of the pandemic on people, and we're just now starting to study the effects of the pandemic on organizations. So that's important to keep in mind, or one thing I'm keeping in mind when I'm looking at how rural police agencies are responding to the pandemic. This isn't my, I guess, main line of research. I study police accountability and police misconduct. So this is interesting to me just to look at a different topic. So the data comes from a few different places. The first place is, my list of agencies that I gathered, and these were chosen from the 2016 FBI Crime in the United States webpage. Table 26 provides information about full-time law enforcement employees, and that data is collected through the UCR program. So it is voluntary. But what I did was, definitions of rural vary. So I started with a cutoff of providing service to 10,000 residents. And I went through and gathered all the names of all those agencies and then looked on their webpage to try to get an email address of a command staff, a chief, or someone in that upper level of command. Sometimes they just had a generic email address I sent a message to get an email for someone in a command position that can answer some questions about the organization. That brings me to my survey instrument. It was about 38 questions. Ask questions related to preparedness to the pandemic. Do officers have PPE, personal protective equipment, the ability to provide those things? And I'll share some descriptives here in a second. I really haven't had the chance to, I just started cleaning the data. I really haven't had a chance to dive into it. And then there's still some pieces I want to collect as well, which I'll talk about in a second. I collected some county level health data from the Johns Hopkins Coronavirus Resource Center. They provide information on total infections, different statistics about the coronavirus infections at a county level perspective. And I still need to collect some data on, investigate rurality a little bit more in my study, because I started with the definition of rural being 10,000 or less, and that's going to vary. You could have a community of 9,000 next to sort of a large, metropolitan area. So I'm looking at the 2013 Rural Urban Continuum Codes. It contains 3 metro categories and 6 non-metro categories from 1 to 9. So eventually I'm going to have to go through these things and check to see how rural, my non-random sample really is. So this is like I said, I just started cleaning the data, running behind on a lot of things, a lot of projects, as it's pretty normal in the year 2020. But the mean population of these cities these agencies are coming from is just over 4,000 residents. And I started to look at, some of the characteristics about these organizations, and one of them is officer gender. So we know that agencies are particularly male, and they employed just over 9 front level line officer male officers, and just over like 1.5 females was the mean for the agencies, female officers. And then you can see the total confirmed COVID-19 per 100,000 as sort of a rough measure of the intensity of the pandemic or the infections at the time the agency took the survey. And there are some other control or agency level characteristics I want to gather as well. But these are the things I've gotten a chance to clean and find. So I asked the first question on the survey, asked if the agency had a policy providing guidance for development of contingency plans related to the effects of pandemic or a similar health emergency. So I looked at this as being prepared, and just under 2/3 of police agencies have a policy in place to sort of guide the organization through a pandemic or similar health emergency. I asked about PPE. Almost all the police departments officers were equipped with PPE while on duty. And I also asked the ability to provide officers with PPE as well. And I did forget to mention I had 313 completed surveys. I think I landed with Rosie just hit the button there. I think I landed at about a 15% response rate as well. I asked if the first line supervisors in the top left there have been tasked with regularly inspecting PPE. Just over half were tasking supervisors with inspecting PPE. I asked about if they were providing training to officers regarding topics related to the pandemic. Almost just under 2/3 are, yes, they are providing training. I also asked, has there been formal tracking of officer health utilized during the pandemic, and any type of health screening being utilized before officers start a work shift during the pandemic, since we know that they're possibly coming into contact with members of the public. And as far as formal tracking of officer health, just under 1/3 were doing that, and just under half of the agencies were providing some sort of health screening before officers start a work shift in the pandemic. I also asked if the police agencies were taking an effort in reducing contact between them and the members of their public, and I asked about certain situations. So these are the percent of agencies identifying these things to reduce face-to-face contact. So you can see that lost property and phone harassment, things that they don't have to maybe respond to, can take something over the phone. And you can see these maybe arguably more personal things like assault reports where no medical attention is. Most agencies are still sort of thinking about responding to those in person. I also asked if they're thinking about maintaining optimal work conditions during the pandemic. So you can see that many agencies are thoroughly cleaning and disinfecting work areas, encouraging officers to stay home when sick, taking precautions when interacting with a sick member of the public, and wearing personal protective equipment, like PPE masks, safety goggles, face shields, gloves while they're in a work shift. So like I said, I haven't really been able to investigate this in depth as much as I would have liked right now. I'm still cleaning the data a little bit and collecting some of that other information. And, the important thing is I am finding, even though this is cross-sectional at a certain point of time, I am finding that some agencies are responding to the pandemic by providing PPE, training, and health screening. I'm excited to see where this project goes as I clean the data and I'm able to run a few more statistical techniques, even correlations, some type of regression, whether it's logistic or ordinal, depending on the variables that I'm interested in. But I think the important thing going forward is what are the correlates of these specific responses: infections in the county, population, other agency characteristics, even the region. So that's just a little overview of what I'm looking at right now, and I'm excited to see where it goes and what I find in the future. So thanks for watching. Have a great day.